Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it with the Dental Student Vibes podcast, and today we have part 2 of our awesome oral surgery interview with Dr. Eric Holmgren. Today we switched up a little bit. We sit down and talk to him about all things private practice oral surgery, how it differs from general dentistry in private practice, and what you can expect when you go into private practice oral surgery. This was a really cool interview because we had never really had any sort of oral surgeon type material focus. So tune in, listen to it. He gives great feedback on all things student loans, how it's changing, where loans are increasing and everything. So you guys really, really want to listen to this. We love talking to him. We hope you guys enjoy it. Follow us on Instagram at dental.student.vibes and give us a like, comment, review. Whatever you guys want to hear, let us know and we'll find somebody to talk about it. So as always, stay safe and vibe on.
So you also said get a ton of experience beforehand. So what are your thoughts on doing mission trips and just sort of those big surgery-based trips, I guess?
Yeah, I mean, I did. I love mission trips. I went to Kenya a couple years ago, and I recently, about a year ago, I went to Guatemala, and I set up. This is an ad hoc thing. I just brought some instruments to my office and went with a primary care physician, and we put 3 chairs in a clinic, and I just numbed people up and took out teeth, no drill or anything like that. And so yeah, I'm a huge fan of helping people with extractions and volume, and so long as you have someone there to bail you out, that's huge. Yeah, so I would, big surgery you're just going to watch, you're not going to get a lot of, but if you're there to sort of give blocks and maybe do some basic dentistry and a lot of extractions, that's super helpful.
Okay, cool. Awesome. So I just want to wrap up this segment about your oral surgery residency. Is there any tips so we talked about getting into the residency. How about before moving on into practice?
Yeah, so as you're going through residency, you're starting to get a flavor for what you like to do, just like when you're in dentistry, you know what you like to do. Mm-hmm. Gosh, am I ortho? Am I generalist? Am I, and for me, like I really enjoyed, I don't know, I guess I enjoyed all oral surgery, but I really had a liking for, the academic hospital environment. There's something about the discipline of that environment which resonated with me. So I think as you're starting to go through things, you'll kind of take three forks in the road. Am I a private practice person? Am I a fellowship kind of guy who wants to do, a fellowship in craniofacial or head neck and be, like doing major big cases?
Mm-hmm.
Or am I sort of an academic guy who wants to just jump right into, being in a teaching center and teaching residents and doing tertiary care? So I think those are really your only three options. And that's something that you will figure out as you're going along. And again, it's like, can you not wait to get in the OR and do that 6-hour case? Are you just like dying for that? Or are you like, God, I can't wait to get out at 5 so I can, go golfing, And I just love dental alveolar surgery and the efficiency of it and the money of it. And so, you'll figure that out. Or do I want both? And it turns out I was kind of the guy that I couldn't figure it out. I wanted all three. And then, so graduating for me, I had some academic offers and I highly considered that. But then I had these 2 little baby girls and I was like, oh, and I had all this debt. And then we were kind of stuck out in Portland. And I'm like, all right, I'll just go back to the East Coast where my wife kind of grew up and I had some job offers. I'm like, let's just go into private practice for a couple of years and make some money and get used to it. And then I blink and 14 years have gone, and so, hence my transitioning into, academic practice now to sort of scratch that itch, so that never went away.
Right. Gotcha.
Family life takes over.
Okay, great. So that's everything for residency. Now, big question. What's it like for the oral surgeon entering into private practice? What are the biggest changes? What was your journey through that? Did you become an associate first, or did you own, or how did that all work?
Yeah, so I became an associate. I just got a job offer, and what attracted to me was we were wanting to grow the practice and start a new office. So I like the idea of growing something and being part of that, as opposed to just being in one office with a bunch of guys and gals or just figuring it out. I like the idea of some progress and growing and filling a need.
Mm-hmm.
So I wasn't really attracted to going to say, hey, let's go back to San Diego and practice with 5,000 other oral surgeons and fight and compete. And I wanted to go somewhere where my services were needed and I could just work right away and take help a community.
Right.
And so I think that was important. And so I did an associate for a year, and then there's I did a buy-in process, which was talking to a bunch of other oral surgeons was, I think, pretty fair and kind of routine.
Mm-hmm. Okay. So when you're going through all this and you're just starting out, so just in general, what is your goal setting process? Do you have a process for setting goals?
Oh, I wish I did. I'm a little bit messy on that. I think mainly, I don't know. I have 3 girls now and my wife, and we're just a real busy family. And so work, and I come home and it's like, crazy. And then I try to do something and I fall asleep. So I think that I mainly focused on my instinct of like, I got to take care of this family. I've got to get my finances in order. I've got to, my happiness and my career goals are put on the side until I can get financially fit and
right.
make sure everyone's taken care of. And so I was really good about setting financial goals and just getting that accomplished.
Awesome. So let me ask you more about that.
Yeah.
Because are you familiar with how much dental students are coming out of school with right now?
Yeah. Oh my gosh. Yeah.
Wild. I'm coming out with between 400 and 500.
That's it?
Yeah. And no residencies or anything yet. So we'll see. But
yeah, I thought like 250 was just wacky for me, but yeah, it's tough.
And people still think it's only like 200. No. And I think the students that are entering into dental school either this year or just got accepted, whatever, they're going to have 600, like easy.
Nuts.
And that's just for general dentistry. So tell me about your financial process and how did you go about paying back your student loans?
Well, Okay. So I think financial success and is like winning a Super Bowl. I think that your domestic partner is important, and one has to be an offensive player and one has to be a defensive player. But if you look back, all Super Bowl teams really win with good defense. And so I'm lucky and grateful to have my wife as a huge defensive star. So she's super frugal. If it's over $30, you got to let me know.
Wow.
And we kind of joke about that. It's our thing, you know. I mean, it's not like that. But so first of all, you're finding a domestic partner where you guys are, jive. I'm pretty good at offense. It's what I do, and I'm not very good at defense. So starting there, when you get out of dental school, live like a student, or if you get out of residency, live like a resident. I mean, don't get doctoritis, and buy the McMansion with granite and stainless steel and lease to Tesla. That'll come, man. That'll come. The other mantra to have is get to the point as quick as you can where you work because you want to, not because you have to. Honestly, practicing dentistry and medicine is so sweet when you really just want to do it.
Right.
And patients sense urgency. They sense desperation. And I've interviewed employees who I know are down and out, or people who want employment and they're down and out, and you can just tell their desperation. And that, you can tell that. Patients can tell you that you're like, oh yeah, you need a bridge, no implant. We got to do the bridge because I need that $3,000. I'm not going to send you the referral. And they know that. Oh, I need to do the extraction. I need the money. Like they sense that. So I think by really living frugally and getting your debt paid off as quick as you can. Kind of cheesy, but I do. Dave Ramsey's Dave Ramsey.
Oh, yeah.
Has some great baby steps. I mean, those are awesome.
Say like, don't even go to dental school.
Yeah, I don't. I mean, come on.
No, I get what you're saying though.
Yeah, you got to invest in yourself, but like afterwards, just hammer it out. And it'll come quick. And then as soon as you get to that point, it's sweet. And if it takes 5 years, whatever, then it's going to pile on, and you're going to have a great foundation. And I hope that was helpful.
Oh yeah, definitely. So, okay. Now we're moving past all that sort of stuff. We're going to head into more the business aspect. So when you are in an ownership position, this is the broadest question ever, but what is some business advice you would give to a newer dentist?
Don't leave when things get a little rough right away. If you're struggling, you hate your partner or your employer, you hate your assistants, and you hate coming into work, that's okay. Something like today, I kind of hated it, like it ends up being work after a while, and the sexiness of dentistry and treating patients and doing cool things sort of wanes a little bit. So I would say just wallow a little bit. Don't make any changes. The grass is always greener, but I think to be really financially successful, you sometimes have to just sort of sit down and just sort of, here I am, grow where you're planted. Try not to, follow the wind and something's going to be better, because it's never going to be better. Right. So just try to grow where you're planted.
Okay, I like that.
I think that, so a lot of times you'll go, oh, this is so not working. I get another place. Oh, this is, and you're just going to end up like moving, and you're not going to be able to get your patient population. It takes about 5 years to really get a good referral base. 5 years, and now it's like, it's tough to leave that. Right. It just takes time.
So what's the difference, would you say, practicing as an oral surgeon versus practicing, like what's the day-to-day more like the differences between practicing as an oral surgeon versus practicing as a general dentist?
I think for me, there's really quick pace. We stand up the whole day. I don't sit down. Um, I think that, I'm doing a lot of quick procedures. I'm not seeing patients back as much, although I do love seeing the patients, regularly. I do miss that part of things. I like having relationships with some patients. I think, we're referral based. So, we're kind of dependent on referrals, and, we're somewhat emergency based, since we have to have patients for, I had an emergency today. I'm like, oh, I just want to go home, but all right, let's do it. We got to do it. And so I think it's hard to, and, Fridays and Mondays are pretty busy for us because stuff happens over the weekend and before the weekend. So it's hard to take Fridays and Mondays off.
Mm-hmm.
That's usually our busiest time. So I would say that's, maybe a bigger difference. Maybe not. I don't know.
Yeah. Now let's talk about the fun stuff. Ringside physician. Tell me about that.
Oh yeah.
Let's talk.
Yeah,
That's got to be one of the coolest photos I've seen. So tell me more about that.
That was so. So I when I moved here to Western Mass, a couple of my buddies were orthopedic surgeons, and they're sports medicine docs, and the athletic trainers at the local college would always call me, and it's like, hey, can you do this facial act on this lacrosse player or field hockey player? And so I just got my little doctor bag out and kept it at home because I was tired of going to the office, and I would just suture them up in the training facility or at the college. And then the orthopedic guys were like, oh, I'm stuck, can you go cover that hockey game? And I'm like, all right. And so I've been doing that the last 12, 14 years, and doing a lot of sports medicine. And I got one situation where it was just, the hockey game was a playoff game, and it must have been like, I don't know, 2,000 people there. It was small, it was packed. And then this one guy got jammed against the boards, and he just totally passed out. And I was the only person there. And the athletic trainer was kind of waving over, and I just went on the ice, and we had to take his helmet off, and we had to do some just assessment. He wasn't waking up, and we called the ambulance, and he woke up, and, just doing some general triage. I'm like, I kind of really like this stuff. I love sports. It's different to watch sports when you actually have to watch it with some acuity. Like, okay, do I have to go on the ice, or is the athletic trainer going to call me? So you have to really watch with attentiveness. And I loved watching sports when I was actually involved. I wasn't playing, but I was totally involved and felt responsible.
Right.
And I was like, wow, I really love this. And I just Googled sports medicine, and then I swear I was watching some TV show about a fighter who had his ear drained by a ringside physician. I'm like, what's a ringside physician? And it happened to be correlated with that, so I Googled a ringside physician, and I came across American Association of Ringside Physicians, AARP.
Okay.
Well, maybe it was different, but I'm like, okay. And then I clicked on it, and I'm like, the president. I emailed him, and I'm like, hey, I'm in Massachusetts, Oral and Maxillofacial Surgeon, and I want to do this. And he emailed me back right away. He's like, oh yeah, I'm down in Brazil with boxing, USA boxing. Yeah, why don't you give Lou a call? Here's his number. He's in Massachusetts. Why don't you go to a UFC, or not a UFC, but an MMA bout with him and see if you like it? And I'm like, so I called Lou.
Right.
And I went and hooked up with Lou, who's an ER doc in Middle Mass. And I'm like, man, this is great. So I shouted him for a couple of bouts, and then the state hired me the athletic commission hired me to be ringside physician. And there's about 8 of us in the state. There's all different specialties like ER, mm-hmm. neurologists, one plastic surgeon, one family doc, and I'm the only OMFS guy. And so they'll call us, and I'll cover like amateur boxing that in a basement. It feels like I'm in a basement somewhere, and then I'll get called up to go to the UFC at the Garden, and, wow, and do
that's incredible
UFC fights. Or I'll go do like MMA fights that are in a basketball gym at a high school with people that are out of shape. And so I probably do that like 8 times a year. It's a weekend gig, and I just love it, and especially when it's like on TV and stuff, and UFC. It's really awesome.
Are you a Bruins fan?
No, well, not really. No, I mean, I not a huge hockey fan, but
You like
I'm a Celtics fan though.
the Celtics? Okay.
Yeah.
So what are some of the things that you actually do? Is this something that OMFS normally does, or is it usually ER or?
All you have to have is you have to have a medical degree and a medical license. And so there's really no, so I would do, like I've put shoulders back in, I've sutured
Oh, okay.
backs. And so you're doing some kind of general medicine, like if you have your medical degree, you can just do stuff, like, I mean, you can just, like, I can suture up an elbow, or I can assess for someone who needs to go to the ER, or, evaluate concussion or spine injuries. And so, there's a little bit of, sphincter tone there when you're in the middle. And I've gotten in some situations where guys aren't waking up in the middle of the ring, or I've had to call off bouts and the fans are booing me.
Wow.
Yeah, there's one ESPN boxing night. It was the final. It was the main event, and they stopped, and the ref called me over, and I had to talk to the guy, and I said, okay, let him play. And then he got knocked out like 1 minute later. And then they were interviewing me. Why did you let him back in? I'm like, well, he looked good to me. And so there's a lot of little fun things with that. But I think one of the things that I like about it is I enjoy putting myself in uncomfortable positions and challenging myself.
Mm-hmm.
I feel like I can do it, but I mean, you got to put yourself out there at times, and that was an avenue for me to sort of spark up my career and also just challenge myself a little bit.
That's very cool. You're going to have to send me some of those photos. Have you gotten any of this stuff on video of like the actual injuries that I'm sure you have.
Yeah. I mainly have I got all these photos. The ones I sent you were of my mom watching pay-per-view, and she texts the TV that, here's my son on TV.
Yeah.
So a lot of those photos were my mom texting me, but just me on TV. But I don't have any gory things. It's hard to take pictures when you're kind of like triaging it and cleaning it up.
Exactly.
And let me take a picture. But I do have that. Yeah.
That's a great photo. We're going to use that. So you ever heard of Bloody Tooth Guy?
Yeah, I like him. He's great. Yeah.
He's great. So
my assistant turned me on to him, and so I follow him. He's cool. Great pictures.
Yeah. He's great at it. And then also I don't know if he still is keeping himself anonymous. Is he still doing that? I'm not sure.
I don't know. I saw like an IGTV thing with his face on there, and
really. So I guess he released it all.
And something about Long Island where he practices, I think. But I haven't gone hardcore, really cared too much about that. But
okay. Well, hey, the ringside physician, that is such an incredible experience. I hope do something like that someday. I don't have an MD. I don't know if I will. Maybe I will. We'll see.
Yeah.
But that's
I think that's one advantage of an MD. If you choose oral surgery, you can actually kind of do some things with it. I mean, I don't really make any money at it, really. It's one thing to do, but yeah.
So tell me about this coaching, this mentoring service that you are starting to get into here.
So the last couple years, I was sort of involved in coaching. One of the inaugural programs at Dartmouth Medical School was medical school coaching, and it's been something that's been very popular in medical schools where you take physicians that are have a position at the medical school like I do, and you get assigned, they train you to be a coach, and they're finding that having med students assigned to a mentor and a coach throughout their medical school is super beneficial from just wellness, and so basically there's a curriculum, it's called On Doctoring, and a coaching curriculum where we have small group sessions and mandatory one-on-one sessions, and there's just things students have to actually do as assignments to address their own wellness and setting goals. And again, it was one of those like ringside moments where, okay, that sounds different. Let's just do it. And that was super hard and super uncomfortable, just having these students just look at you and go, okay, coach me, So, but after a while, like, oh man, I would look forward to it. I loved that. And, I think my coachees or my students are getting a lot out of it. And I just like to talk to students who are in that place of life where they are trying to decide what they're doing and dealing with a lot of issues in terms of, can I do this? Am I an imposter? What should I do? How do I navigate this? And it's not like I'm telling them what to do, but I just love, helping them through that, discover that. And I just found, real joy in that. So one of my thoughts was, my wife, I would do some coaching sessions at home, and she was like, you really are good at this, and you need to just do that more often, because I think you are more happy when you do that. And so I thought, well, maybe I'll just start this coaching service. And I just kind of, put it together and throw it out there. And I would have loved to have that in dental school. So I'm kind of, reaching out to any dental students or med students, or even like residents who are going through things, just a sort of convenient way to just sort of talk and maybe get some help. So I've started that, and I'm going to see if that, goes anywhere, and I hope it does take off.
Absolutely.
I just really enjoy it, because I think everyone needs a coach, and someone who's been through a lot too, be able to just sort of talk and strategize together in a sort of an unbiased way. So.
Right. I mean, you see the most successful people in the world, they all still have coaches, right? So
Yeah.
The website is wdlcoaching.com. So when students reach out to you, what can they expect? How do they kind of sign up? They sign up through the website?
Yeah, basically, there's just it's a pretty easy, you just kind of name, email, and then it takes you to a Calendly page where you can just click and sign up for a free, coaching call, and just talk about, hey, what's going on with your life? What do you need help with? And are we a good fit? And what it takes to, get through what you're getting through. And so it's pretty straightforward on the website.
Awesome. So Eric, hey, listen, hour flew by like that.
Oh, wow. Okay, cool.
Yeah.
Nice.
It's been great talking to you. Thank you for sharing all of your experiences. This is the first real sit down I've had with an oral surgeon and be able to go through everything. So I really appreciate sharing everything with me, and then of course with all of our listeners. So
yeah.
I'm going to shoot this interview over to all my buddies that are about to do oral surgery. So They're going to love it. So
nice. Well, yeah, if anyone wants to reach out, they can, get a hold of me, and I'm happy to.
What's the best way to contact you?
Yeah, I think if you go through the website, but also at the Instagram at WDL Coaching, you can direct message me there. That's easy too. And so, yeah. And,
all right.
Yeah, it was really nice talking to you. You're good at this.
Appreciate it. All right. Thank you, Eric.
Yeah. All right.
All right, guys, that'll do it for our interview with Dr. Eric Holmgren. He's an oral surgeon in Massachusetts. We hope you guys enjoyed this interview. It provided a fresh take on a different specialty we haven't normally talked about. So if you guys want to hear more about oral surgery, endo, whatever specialty you want to hear, if you're considering going into that realm of dentistry, let us know. We'll find somebody for it. Or if you guys have somebody in mind, shoot us that name and we'll reach out to them. As always, stay safe and vibe on.